Today we are going to discuss the anatomy and surgery of inguinal hernias. So this is a paper demonstration and it can very easily describe the hernia system. So actually we have divided into different 3 layers. ठीक है, आप इसमें से मुझे layers के 1 by 1 नाम बताते जाएंगे. ठीक है, ये है fascia transversalis लिखा हुआ है, चलो इधर भी कर लेते हैं. तो दिस इज द फर्स्ट लेयर. ठीक है, फर्स्ट लेयर किससे इट इज कंपोज्ड ऑफ, और इसके अंदर आप ये देख सकते हैं, ये दिस इज कॉल्ड सुपरफिशियल रिंग, सुपरफिशियल इंग्वाइनल रिंग. तो दिस एनाटॉमी डेमोन्स्ट्रेट कि देखें ये इट इज प्रेजेंट इन दी the superficial inguinal ring is present in the external oblique aponeurosis. It is just an opening, triangular opening in the external oblique aponeurosis. And inward folding of external oblique aponeurosis forms the inguinal ligament. तो ये मैंने एक कॉन्सेप्ट भी दिया है कि this is the inward folding. आप देख रहे हैं, if you can see, this is inguinal ligament. So it is attached here at the pubic tubercle, and this is anterior spherical spine. So the second layer is the conjoint tendon. This is formed by the transverse abdominis muscle and internal oblique, and some fibers are attached with the external oblique here, like this, right? And the third layer is fascial transversalis, and this ring is called deep ring. Okay? It is deep inguinal ring is present in the fascia transversalis, and you can see the cord entering from deep inguinal ring and passing through the inguinal canal and exiting through the superficial inguinal. So you can see it here, and here it is covered by this conjoint tendon. So what we do in the hernia surgery, we just place down a nick here in the external oblique aponeurosis like this, and then with the help of the scissor, I will divide this, and I will just open up this superficial inguinal ring, right? And then it will be lifted as like this. These 2 leaves, these will be lifted like this, right? And the canal will be opened up. And here is the area of inferior epigastric arteries, inferior epigastric vessels. Here are the inferior epigastric vessels. Where is the red pen? This is the inferior epigastric vessels. So if the hernial sac is present medial to it, it will be direct inguinal hernia, and if it is present lateral to it, it will be indirect inguinal hernia. After dealing with the sac, what we do, we just put down a mesh like this here in the space between the inguinal ligament and conjoint tendon here, right? The mesh will be placed below, will be it is attached to the inguinal ligament, and above it will be attached to the conjoint tendon. And just this layer will be, the anatomy will be restored by suturing this layer, right? So this is the complete demonstration of inguinal hernia surgery. Very simple. Chana, thank you so much.